Question 1. A CNA is assisting a resident with a restorative bathing program. Which action best promotes the resident's independence and dignity? A. Completing the entire bath quickly to ensure the resident is clean and comfortable. B. Guiding the resident's hands to wash their own face and upper body while providing verbal encouragement. C. Allowing the resident to refuse bathing if they express a preference to skip it for the day. D. Delegating the bathing task to another CNA if the resident is slow or uncooperative. Answer: B. Guiding the resident's hands to wash their own face and upper body while providing verbal encouragement. This question tests the core concept of restorative care, promoting independence. The keyword "best promotes independence" indicates that the CNA should encourage the resident to do as much as possible for themselves, rather than doing it for them. Guiding a resident's hands and offering encouragement allows them to participate actively in their own care, building their self-esteem and maintaining their functional abilities. For instance, instead of washing a resident's face, a CNA might place the washcloth in their hand and gently assist their movements. Always remember that true restorative care empowers residents to do what they can, even if it takes more time. Question 2. A resident who previously walked independently now requires a cane for ambulation due to recent weakness. What is the most important observation for the CNA to report immediately to the nurse regarding this resident's ambulation? A. The resident complains of mild fatigue after walking 50 feet. B. The resident consistently uses the cane on the correct side, strong side. C. The resident's gait becomes unsteady, and they frequently grip furniture for balance. D. The resident expresses frustration about needing to use a cane. Answer: C. The resident's gait becomes unsteady, and they frequently grip furniture for balance. This question assesses the CNA's understanding of safety and critical observation in restorative care. The phrase "most important observation to report immediately" points to a situation that poses an immediate risk to the resident's safety. An unsteady gait and gripping furniture indicate a significant increase in fall risk, which could lead to injury. While fatigue and frustration are important to note, a sudden decline in balance during ambulation warrants immediate attention from the nurse to prevent a fall or reassess the care plan. Prioritizing safety means recognizing and reporting any signs of increased instability right away. Question 3. A CNA is assisting a resident with passive range of motion (ROM) exercises. What is the primary purpose of performing passive ROM exercises? A. To increase the resident's muscle strength. B. To prevent joint stiffness and contractures. C. To improve the resident's cardiovascular endurance. D. To assess the resident's pain tolerance during movement. Answer: B. To prevent joint stiffness and contractures. This question evaluates the fundamental goal of passive ROM. The phrase "primary purpose" directs you to the main reason these exercises are performed. Passive ROM involves the CNA moving the resident's joints, which helps maintain flexibility, improve circulation, and prevent complications like contractures, a severe tightening of muscles that limits movement. It does not build muscle strength, as the resident is not actively participating. For example, gently moving a resident's arm through its full range of motion helps keep the elbow and shoulder joints from stiffening. Remember, passive ROM is all about maintaining mobility and preventing stiffness. Question 4. A resident is participating in a bladder retraining program. Which action by the CNA is most crucial for the success of this program? A. Restricting the resident's fluid intake to reduce incontinence episodes. B. Offering fluids only during meals to establish a routine. C. Following a strict toileting schedule and documenting all voids and incontinent episodes. D. Placing a disposable pad in the resident's brief at all times to manage accidents. Answer: C. following a strict toileting schedule and documenting all voids and incontinent episodes. This question focuses on the essential components of a successful bladder retraining program. The keywords most crucial for the success highlight the actions that directly lead to improvement. A strict, individualized toileting schedule helps the bladder learn to hold urine for longer periods, and meticulous documentation provides data to track progress and adjust the plan as needed. Restricting fluids is generally counterproductive and harmful, as adequate hydration is necessary for bladder health. Think of it like this: consistency and tracking are key to any training program, whether it's for a person or a pet. Question 5. The charge nurse asks the CNA to encourage a resident, who is recovering from a stroke, to use a long-handled reacher to pick up items from the floor. This is an example of promoting what aspect of restorative care? A. Promoting muscle strength. B. Promoting cognitive function. C. Promoting independence with adaptive equipment. D. Promoting improved balance and gait. Answer: C. Promoting independence with adaptive equipment. This question assesses understanding of how adaptive equipment supports restorative goals. The key phrases are long-handled reacher and pick-up items, which immediately point to assistive devices. Adaptive equipment, like a reacher, is specifically designed to help residents perform tasks they might otherwise struggle with due to physical limitations, thereby increasing their ability to care for themselves and reducing reliance on others. For example, a resident who cannot bend over due to back pain can use the reacher to pick up dropped items, maintaining their self-sufficiency. Always recognize adaptive equipment as a tool to empower residents to do things for themselves. Question 6. A resident with early-stage dementia is becoming increasingly frustrated during dressing because they cannot button their shirt. What is the best restorative approach for the CNA to take? A. Button the shirt for the resident quickly to avoid further frustration. B. Provide a shirt with hook and loop fasteners, Velcro, instead of buttons. C. Tell the resident to try harder and offer verbal instructions repeatedly. D. Leave the resident to dress independently, returning later to check progress. Answer: B. Provide a shirt with hook and loop fasteners, Velcro, instead of buttons. This question tests the CNA's ability to apply restorative principles in challenging situations, especially with cognitive impairment. The keywords increasingly frustrated and cannot button suggest a need for adaptation and support. Providing adaptive clothing, like shirts with hook and loop fasteners, allows the resident to complete the task successfully and independently, reducing frustration and maintaining dignity. It's about modifying the environment or task to enable success, rather than simply doing it for them or demanding more effort. Remember, restorative care often involves creative solutions and adapting to the resident's current abilities. Question 7. A resident who uses a walker for ambulation expresses reluctance to walk because they feel it's too slow and embarrassing. What is the most appropriate response by the CNA to support restorative efforts? A. It's important for your health to walk, so let's just try to go a short distance. B. Many people use walkers, there's nothing to be embarrassed about. C. How about we walk to the activity room together to get some fresh air? D. I understand it can feel slow, but every step helps you get stronger. We can go at your pace. Answer: D. I understand it can feel slow, but every step helps you get stronger. We can go at your pace. This question assesses the CNA's ability to provide therapeutic communication and motivation in restorative care. The key phrases reluctance to walk and too slow and embarrassing highlight emotional barriers. Acknowledging the resident's feelings, I understand it can feel slow, and then reinforcing the positive impact and offering control over the pace, every step helps you get stronger. We can go at your pace, is the most effective way to encourage participation. This approach validates their emotions while still gently encouraging the restorative activity. Always remember to be patient and encouraging, focusing on the resident's progress rather than speed. Question 8. A resident has recently been experiencing difficulty transferring from the bed to a wheelchair independently. What is the most critical immediate action for the CNA to take? A. Encourage the resident to try harder to stand up on their own. B. Get help from another CNA to perform a two-person assist for safety. C. Document the resident's reduced ability and continue to monitor. D. Provide verbal cues only, guiding them through the steps. Answer: B. Get help from another CNA to perform a two-person assist for safety. This question emphasizes safety and the CNA's immediate responsibility when a resident's functional status declines. The phrase, most critical immediate action, points to the need for prompt intervention to prevent injury. If a resident is struggling with a transfer, their risk of falling significantly increases. Obtaining immediate assistance from another CNA ensures the transfer can be completed safely, preventing potential harm to both the resident and the CNA, before reassessing their baseline ability. Always prioritize safety in transfers. If in doubt, get help. Question 9. During a restorative feeding program, a resident consistently pockets food in their cheeks. What is the most appropriate action for the CNA to take? A. Stop feeding the resident and report it to the nurse immediately. B. Remind the resident to chew and swallow after each bite, offering smaller bites. C. Give the resident softer, pureed foods to make swallowing easier. D. Document the observation and continue feeding as usual, expecting improvement over time. Answer: B. Remind the resident to chew and swallow after each bite, offering smaller bites. This question tests the CNA's practical application of restorative feeding techniques. The term pockets food indicates a potential swallowing difficulty or habit that needs careful management. Gently reminding the resident to chew and swallow, and offering smaller, manageable bites, directly addresses the issue in a supportive way, encouraging proper intake and reducing the risk of choking. This is a common strategy in restorative feeding to help residents learn to manage food safely and efficiently, rather than immediately stopping the feeding or changing their diet without a nurse's assessment. Patience and appropriate pacing are essential for safe and effective feeding. Question 10. A resident is participating in a daily walking program. The CNA notices the resident favoring their left leg and grimacing occasionally during the walk. What is the CNA's best response? A. Tell the resident to push through the pain to meet their walking goal. B. Immediately stop the walking program and help the resident return to their room. C. Ask the resident about the pain, observe their gait for changes, and report findings to the nurse. D. Continue the walk but suggest the resident rest more frequently next time. Answer: C. Ask the resident about the pain, observe their gait for changes, and report findings to the nurse. This question focuses on the CNA's responsibility for observation, communication, and reporting during restorative activities. The keywords favoring their left leg and grimacing occasionally are clear signs of potential pain or discomfort. The best action is to gather more information by asking the resident and observing, then immediately report these crucial findings to the nurse, who can assess the situation and modify the care plan if necessary. It's vital to never ignore signs of pain during restorative care, as it can indicate injury or make the resident unwilling to participate further. Question 11. Which statement best describes the primary goal of restorative nursing care for a resident? A. To perform all activities of daily living for the resident to ensure comfort. B. To teach new, complex skills that the resident has never performed before. C. To help residents maintain or regain their highest level of physical and mental function. D. To keep residents quiet and calm to prevent disruptive behaviors. Answer: C. to help residents maintain or regain their highest level of physical and mental function. This question directly tests the fundamental definition and purpose of restorative nursing care. The keyword primary goal asks for the overarching objective. Restorative care is about empowering residents to achieve maximum independence, whether by regaining lost abilities or by maintaining existing ones. It's explicitly not about doing everything for them, which fosters dependence, nor is it about teaching entirely new skills or simply managing behavior. The aim is always to help residents do as much as they can for themselves, promoting dignity and quality of life. Question 12. A CNA is assisting a resident with a restorative dressing program. The resident takes a very long time to choose clothes and seems overwhelmed. What is the most effective approach for the CNA to take? A. Choose the outfit for the resident to save time and prevent frustration. B. Present 2 clothing options for the resident to choose from. C. Tell the resident to hurry up so they can stay on schedule. D. Ask the resident's family to bring in simpler clothing choices. Answer: B. Present 2 clothing options for the resident to choose from. This question addresses a common challenge in restorative dressing programs, especially with residents who may have cognitive difficulties or decision fatigue. The phrases "very long time to choose" and "seems overwhelmed" indicate a need for simplification. Offering a limited choice, such as 2 options, empowers the resident by allowing them to make a decision while preventing them from becoming overwhelmed. This promotes independence and participation without causing undue stress. It's a way to provide choice and control without overburdening the resident. Question 13. A resident's care plan includes active range of motion (ROM) exercises for their upper extremities. What is the CNA's role during active ROM? A. To move the resident's joints through the full range of motion without assistance. B. To encourage the resident to perform the exercises independently and provide guidance as needed. C. To observe for any signs of pain and immediately stop the exercises. D. To apply resistance to the resident's movements to build muscle strength. Answer: B. To encourage the resident to perform the exercises independently and provide guidance as needed. This question differentiates between active and passive ROM, specifically focusing on the CNA's role in active ROM. The term active ROM indicates that the resident is actively performing the movements themselves. The CNA's role is to supervise, encourage, and provide verbal cues or gentle assistance if the resident struggles, ensuring the exercises are done correctly and safely. The primary goal is for the resident to move their own joints, which helps maintain and improve muscle strength and joint flexibility. Your role is to be a coach and a safety monitor during active exercises. Question 14. To prevent skin breakdown and promote circulation for a resident who is confined to bed, what is the most important restorative action for the CNA? A. Massaging bony prominences vigorously every 2 hours. B. Keeping the resident's skin consistently moist with lotion. C. Repositioning the resident every 2 hours, including offering to assist with brief periods out of bed. D. Ensuring the resident wears adult briefs at all times for incontinence. Answer: C. Repositioning the resident every 2 hours, including offering to assist with brief periods out of bed. This question tests the CNA's knowledge of essential practices for preventing skin breakdown and promoting circulation in bedridden residents. The phrase "most important restorative action" points to the most effective intervention. Regular repositioning, ideally every 2 hours or more frequently, is crucial to relieve pressure on bony areas, while encouraging out-of-bed time promotes better circulation and reduces pressure overall. Vigorous massage can damage fragile skin, consistently moist skin can macerate, and adult briefs, while useful for incontinence, do not prevent pressure injuries themselves without proper care. Question 15. A resident has recently started using a walker. The CNA observes the resident leaning heavily on the walker and shuffling their feet. What is the CNA's best immediate action? A. Instruct the resident to lift their feet more and stand upright. B. Report the observation to the nurse immediately, as this indicates a fall risk. C. Help the resident sit down and encourage them to rest before continuing. D. Provide verbal encouragement only and continue walking with the resident. Answer: B. Report the observation to the nurse immediately, as this indicates a fall risk. This question highlights the importance of recognizing and reporting safety concerns related to ambulation aids. The observations, leaning heavily and shuffling feet, indicate improper walker use and a significant increase in fall risk, as the resident is not stable. This is a critical safety issue that needs professional assessment. While encouraging proper form is part of the CNA's role, these specific observations warrant immediate reporting to the nurse for a re-evaluation of the resident's balance, strength, and walker fit. Prioritizing safety means knowing when to escalate a concern to the nurse. Question 16. What is the most effective way for a CNA to encourage a resident to participate in their restorative self-feeding program? A. Prepare all food and utensils, and then leave the resident alone to eat independently. B. Sit with the resident, offer verbal cues, and provide adaptive eating utensils as needed. C. Blend all their food to make it easier to consume quickly. D. Feed the resident directly to ensure they consume enough calories. Answer: B. Sit with the resident, offer verbal cues, and provide adaptive eating utensils as needed. This question focuses on supportive techniques for restorative self-feeding. The keyword "most effective way" to encourage points to actions that actively promote participation. Sitting with the resident shows support and allows the CNA to provide gentle verbal reminders, offer encouragement, and introduce adaptive utensils, like plate guards or specialized forks, if the resident needs help with dexterity. This approach empowers the resident to perform the task themselves while still receiving necessary support, differing from simply leaving them alone or feeding them entirely. Question 17. A resident frequently pulls at their clothing or bedding due to agitation. As part of a restorative approach to reduce this behavior, what might the CNA be instructed to do? A. Apply restraints to prevent them from pulling at their clothing. B. Divert the resident's attention with a calming activity or object. C. Ignore the behavior, as it will likely stop on its own. D. Increase the resident's sedative medication to reduce agitation. Answer: B. Divert the resident's attention with a calming activity or object. This question addresses a behavioral aspect often managed with restorative, non-pharmacological interventions. The phrase "restorative approach" to reduce this behavior emphasizes non-restrictive, therapeutic interventions. Distracting the resident with a preferred activity, a comfort item, or engaging them in a simple task can redirect their energy and reduce agitation without resorting to restraints or medication, aligning with person-centered care and restorative principles. Always aim to understand the underlying need causing the behavior and find a supportive, gentle solution. Question 18. A resident is learning to dress independently as part of a restorative program. The CNA should always ensure that the resident's clothing is A. Brand new and fashionable. B. Laid out in the order it will be put on. C. Chosen by the CNA to match current weather. D. Elastic-waisted only to ensure comfort. Answer: B. Laid out in the order it will be put on. This question tests a practical strategy that facilitates independence in dressing. The phrase "should always ensure" indicates a best practice. Laying out clothing in the correct sequence, e.g., underwear, socks, shirt, pants, simplifies the dressing process, reduces confusion, and minimizes frustration for the resident, thereby promoting successful independent dressing. This proactive step sets the resident up for success by breaking down the task into manageable steps. Setting up the environment to support independence is a key part of restorative care. Question 19. A resident is on a bowel training program. Which of the following is an essential component of this program? A. Limiting dietary fiber to prevent constipation. B. Administering a laxative daily to ensure regular bowel movements. C. Establishing a regular toileting time, often after meals. D. Encouraging the resident to ignore the urge to defecate until the scheduled time. Answer: C. Establishing a regular toileting time, often after meals. This question focuses on the core principles of bowel training. The phrase essential component highlights the fundamental elements for success. Establishing a predictable toileting schedule, often after meals when the gastrocolic reflex is active, helps the body relearn a regular bowel rhythm. This consistency is key to retraining the bowel. Limiting fiber is incorrect as fiber promotes regularity, and daily laxatives can create dependence. Bowel training is about re-establishing natural patterns, not overriding them with medications or ignoring urges. Question 20. When assisting a resident with a restorative ambulation program using a gait belt, where should the CNA always stand for maximum safety? A. Directly in front of the resident, holding both sides of the belt. B. On the resident's strong side, slightly behind them. C. On the resident's weak side, slightly behind them. D. At a distance, providing verbal cues from afar. Answer: C. On the resident's weak side, slightly behind them. This question is about the critical safety aspects of assisting with ambulation using a gait belt. The phrase maximum safety indicates the position that best allows the CNA to support and prevent falls. Standing slightly behind and to the resident's weaker side allows the CNA to support the resident if they lose balance or begin to fall, as the CNA is in a position to brace them or guide them safely down. This provides the most immediate physical assistance if the resident falters. Always prioritize safety by being in the best position to offer support. Question 21. A resident has decreased sensation in their feet due to diabetes and is participating in a restorative foot care program. What is the most critical observation for the CNA to report to the nurse? A. The resident complains of cold feet in the morning. B. The resident's toenails appear slightly yellowed. C. A small, reddened area is noticed between two toes. D. The resident prefers to wear slippers all day. Answer: C. A small, reddened area is noticed between two toes. This question tests the CNA's vigilance for serious complications in restorative foot care, especially for residents with impaired sensation. The keywords decreased sensation and most critical observation point to the heightened risk of unnoticed injury. A reddened area, particularly between toes where friction and moisture can occur, is a sign of potential skin breakdown or infection and could quickly lead to a severe wound, ulcer, due to poor circulation and lack of sensation. Other observations are less urgent by comparison. Always be meticulous in checking the feet of residents with diabetes for any changes. Question 22. Which activity best demonstrates a CNA promoting a resident's independence in activities of daily living, ADLs? A. Completely preparing the resident's meal and cutting all food into bite-sized pieces. B. Encouraging the resident to choose their clothes and offering praise for their efforts. C. Performing a full bed bath for a resident who is able to wash their own face. D. Assisting the resident with a complete transfer from bed to chair without any resident effort. Answer: B. Encouraging the resident to choose their clothes and offering praise for their efforts. This question directly assesses the understanding of promoting independence within ADLs. The phrase best demonstrates promoting independence highlights actions that empower the resident to do for themselves. Encouraging choice and praising effort motivates the resident to participate actively in their own care, even if it's a small part of the task. The other options describe situations where the CNA is doing the task for the resident, which diminishes independence rather than promoting it. Your goal in restorative care is always to support, not to take over. Question 23. A resident on a restorative eating program is consistently refusing to eat vegetables. What is the most appropriate initial action for the CNA? A. Remove the vegetables from the tray and offer more of the preferred food. B. Insist the resident eat the vegetables first before other foods. C. Offer a small portion of vegetables and gently encourage a taste, respecting their choice if refused. D. Document the refusal and inform the nurse at the end of the shift. Answer: C. Offer a small portion of vegetables and gently encourage a taste, respecting their choice if refused. This question involves promoting nutrition within a restorative context while respecting resident autonomy. The keyword most appropriate initial action points to a balanced approach. Offering a small portion and gently encouraging a taste allows for participation without forcing, which can cause distress and resistance. It's important to respect the resident's right to refuse, but also to make a good faith effort to encourage healthy eating habits as part of the restorative plan. Documenting the refusal is important, but a proactive approach before documenting is often beneficial. Question 24. A resident is performing exercises in a restorative program. The CNA notices the resident holding their breath during exertion. What should the CNA instruct the resident to do? A. Encourage them to breathe in during exertion. B. Encourage them to breathe out during exertion. C. Tell them to hold their breath longer to build lung capacity. D. Stop the exercises immediately due to potential danger. Answer: B. Encourage them to breathe out during exertion. This question tests knowledge of proper body mechanics and safety during physical exertion, a key part of restorative exercises. The act of holding their breath during exertion is known as the Valsalva maneuver, which can dangerously increase blood pressure and is particularly risky for older adults or those with heart conditions. Instructing the resident to breathe out during the most strenuous part of an exercise helps prevent this unsafe pressure increase. Always teach residents to exhale with exertion to protect their heart and blood pressure. Question 25. The overall purpose of using assistive devices, such as a raised toilet seat or grab bars, in restorative care is to A. Eliminate the need for CNA assistance during toileting. B. Make tasks easier and safer for residents, promoting independence. C. Provide physical therapy only for residents with severe disabilities. D. Reduce the amount of time residents spend in the bathroom. Answer: B. Make tasks easier and safer for residents, promoting independence. This question addresses the fundamental role of assistive devices in restorative care. The phrase overall purpose refers to the broad goal these devices serve. Assistive devices like raised toilet seats and grab bars simplify movement and increase stability, directly enabling residents to perform tasks like toileting with greater ease and safety, thus fostering their independence. These devices are not meant to entirely eliminate CNA assistance, nor are they exclusively for severe disabilities. They are tools to empower residents to maximize their functional abilities.